Good evening and happy Wednesday. I'm Dr. John Podkowa with Health Plus Weekly, joined by my co-host Peter Kohena from Southcoast. And we'd like to thank everyone for coming back to watching us if you've seen us before. And for the first time viewers, welcome. Health Plus Weekly is a new concept we're starting here at Southcoast to help spread awareness of primary care and access to medical experts and questions to help improve patients' health. And tonight we're really excited to welcome Dr. Brett Hurteau, a colleague of mine who I've been working with for 8 years right now, Brett?
That's right.
Dr. Hurteau is a family medicine physician in Dartmouth. He's actually born and raised in this area and has a really great story about how he kind of found his way into medicine and how he's been practicing here locally. So without further ado, I'd like to introduce Brett.
Thank you. Thanks for having me, John.
No problem.
So, yes, I'm Dr. Brett Hurteau. Just wanted to briefly give you my story here. So I am born and raised in New Bedford, down the South End, exactly. And before medicine, I actually worked in the field of fitness and health and spent time training athletes. I actually worked for a period in cardiac rehab at St. Luke's Hospital. Also worked with Tabor Academy football athletes for training. And through that job, I actually had quite a bit of exposure to medicine and health, and realized at that time I really wanted to work more in prevention, and so improving the health of those with disease processes as well. And struck up relationships with physicians and community doctors and others in the area, and was encouraged to go back to medical school, and I did that later on. Actually wasn't really planning on going into family medicine. I actually was thinking of cardiology, and it's interesting because during my medical education, we had to do a rural type rotation in either Maine or New Hampshire, and I spent some time with some family doctors, and it was great because they were the docs, and so if patients had any concern, acute illnesses, chronic problems, orthopedic concerns, their practice was right near a ski slope. So we actually saw a fair amount of skiing injuries. We shot our own x-rays, managed our own orthopedic cases, worked with tertiary care centers and did some home visits as well. And once I really experienced that, I kind of knew, okay, this is what I want to do. And I wanted to really kind of work with all ages, pediatric, adults, and also do some women's health. And that's really what geared me towards family medicine. Did my training at the Brown Family Practice Residency in Rhode Island and found my way to Southcoast about the same time Dr. Podkowa came in. Practiced in Dartmouth and still am practicing. And within the last 5 years or so, I actually I'm an associate professor of family medicine at Brown, working with medical residents as well as students. So quite a variety of things.
So Brett, you care for adults and children, correct?
That is right, yep.
In a certain age, from newborns or?
Yeah, so we do newborns all the way through, and most of our training actually is in pediatrics and women's health, but as well as adults. And in family medicine, the training is 3 years, as most primary care residencies, but a lot of it is based in outpatient medicine. We also do our prenatal care, deliver babies, and also care for newborns and run the newborn nursery. So quite a bit of experience.
That's great.
Yep.
We wanted to focus tonight's show on, kind of close out the year on primary care. We've had several specialists on over the past, couple episodes, and we've gotten a lot of great questions for them, but we know that there is a lot of general primary care questions that people would like answers to and help with. So Brett and I are here tonight to open up any questions if you'd like. Tonight we are fortunate to have someone kind of who can speak to pediatrics, actually some women's health as well. I of course take care of adults, usually ages of 17, 18 and above, men and women. So if you're watching and have a question, please feel free to write in. Or Peter, there's a way that they can do it anonymously as well. Isn't that right?
Yeah, you can text to 508-717 8948, and we'll get your texts anonymously, or you can just comment in the comment section below. And we've already got a few good questions when you guys are ready to take
You ready?
those.
Sure.
All right.
So the first one is from Kaya, and Dr. Podkowa, she actually says that you are her dad's doctor. So she has been suffering from anxiety issues for the past year and sometimes feels like someone is squeezing her heart. Is that possibly connected to stress or anxiety, or could it be something worse?
So we both can talk about this. I mean, a very common complaint, like Brett and I were talking earlier, we see a lot of depression, anxiety in primary care. Generalized anxiety disorder can very often present with a squeezing sensation in the chest. Maybe sometimes you can feel your own heart racing. Sometimes people feel like they have to just get out of a room. They get nervous that something's going to happen. There's a number of symptoms that could be causing it. It's important, and we try to emphasize this on the show a lot, and important to see your doctors, is because other things could be causing those problems as well. So try to make sure that there's nothing else driving those symptoms. But if those are excluded, it's very common to see women or men with anxiety who have those symptoms.
A lot of times the anxiety can manifest into physical symptoms. Is that correct?
Yes. Yeah.
Yeah. So other things such as lightheadedness, chest squeezing, like we had talked about, fluttering of the heart, numbness around the mouth or in the extremities of the hands. Those are some common physical things that we'll see. Abdominal discomfort, irregular bowel movements are also common. A lot of times with anxiety, people have excessive worrying and really worrying about outcomes that may be unreasonable or haven't happened yet. It's also, what you can also find is insomnia, frequent awakenings, or waking up early beyond an expected time. Some of those more common symptoms as well.
If someone is having, experiencing problems with their heart, would you recommend that they go directly to a cardiologist or talk to their primary care doctor first?
What do you think?
No, I think you should see your primary care first. I think, so there's a value of the relationship with a patient and a primary care doctor. So I had thinking about someone from years ago, a person in my practice who was suffering from headaches quite a bit. And that was really the big manifestation. And they weren't really clear based on the symptoms of what they were. And so we were running through medication lists and signs and symptoms and family history. And we were looking at medications they were on and thinking about stopping them. But I think what really, over time, was we, through a overwhelmed or has, have children and working and trying to balance everything out. And then as you go further, you start to see, well, yes, this medication may cause a headache, but it seems like it's a manifestation of something more. Once we started to address that and diagnose anxiety and treat it, their headaches resolved and they did much better. So.
Peter, your question was great about, again, reasons to see a primary. And I think we do a number of things which we love in our job. I think one of the most important things I think we do is we help diagnose people who have symptoms of things, but they are not sure what they are yet. And so it's nice when you feel comfortable coming into an office talking to your doctor about some new sensation you may or not be having, whether it's headaches, whether it's shortness of breath, whether it's your bowels are irregular, whether your ankles are swelling, maybe you're getting some pain in your back, or you have a bit of blood in your urine. People don't know where to go first, or maybe jump to certain things. But if you come to a place where we can help narrow down those symptoms, kind of go through looking at how old you are, what your family history is, whether or not you're on medications, it can save kind of a lot of unnecessary running around and often get to a diagnosis quicker, which is, I think, one of the great things about primary care.
So here's a great, you segued right into this question. So this one's from Mikey, and he says every time he eats greasy food, he gets pins and needles sensation in his chest. So I think the obvious thing would be it could be a heart issue. He probably wants to talk to his PCP. But what are some other things that could be causing that might not necessarily be directly, with his heart?
So what do you? I mean, I think I worry about. I mean, we don't know how old. Is it Mikey? Said his first name.
Mikey. Yep.
So how old Mikey is, but and this is the difference between probably Dr. Hurteau and myself because I only see adults typically, so it's probably a whole separate set of things with the young children. So we're assuming Mikey's old enough.
Yeah, Mikey looks just from his photo, he looks like he's probably in his late 20s, 30s, just from
So based on that, I worry about acid reflux. We see a lot in terms of after eating a greasy food and some sort of abnormal sensation in the chest, gallbladder disease, right?
Yeah.
Dr. Hurteau.
So they call it heartburn because I imagine it had affected people in their heart in some way or in their heart area, but that's strictly a stomach issue. So I imagine there could be some connection.
If it is esophageal reflux, which is when the acidic content of the stomach kind of wash up the esophagus, which passes right near the heart, and then you get these symptoms, and it can very much feel like there's pain in the chest area. So people feel like their heart is burning. Which is,
So actually, an early question that came in from Joel is it good to skip meals? And I know that's a question that's probably better suited for a dietitian and nutritionist, but just in general, I know we've fielded this question before in the past, and typically your rule, Dr. Podkowa, was moderation. Can you talk a little bit about what your general rule is for nutrition?
Yeah. What are your thoughts, Brett, in terms of skipping meals?
Well, I mean, to be honest, a lot of my patients who are obese and have diabetes skip meals, and so they're really there's a lot of negative ramifications of not eating, and so a lot of it has to do with insulin levels and what that does for gaining weight and increasing body fat. So. I generally don't. I mean, in my practice, over the last 9 years we've been around here, I found that patients who generally are healthier will eat a bit more frequently. That doesn't mean sitting down and having major meals, but it means focusing on healthy foods, and you don't always have to sit and have a meal. So you can do that with eating fruit. You can have high protein yogurts. You can have high fiber, low fat foods. Even small amounts periodically throughout the day, I found is helpful.
Question from Brittany. She is looking for some remedies for eczema besides steroid creams and ointments. And I know this might be, she might want to talk to a dermatologist specifically on this, but any general tips that you can give?
So one of the, a simple thing I start with my patients who have eczema or dry skin, especially this time of year, is I tell them to make sure they're not taking excessively long hot showers because that actually can dry the skin out. And it's a pretty common. I think most of us enjoy kind of a long hot shower. But if you have a tendency for eczema or dry skin, it can exacerbate that as well. That's a simple one. Any other simple or anything that you?
No, I agree. I think that people don't moisturize often enough.
Yes.
Probably, like most people say, they do use a moisturizer, but when you really ask them, they don't use it often enough. You can really use it liberally, and that would be helpful. And then, I guess the only thing that for someone who's really struggling and doesn't really respond to typical therapies would be maybe consider being tested for allergies.
Exactly.
Like allergies to food or environmental allergies.
Yes. Yep. And she also, sometimes I tell my patients to do a food diary, perhaps just as a way to, if they can get into an allergy or not, but they can keep track of if they're eating something that may or may not exacerbate their skin, that may or may not exacerbate their skin, they can look at that. And it's also regarding the patient before who spoke about eating something and then not feeling well afterwards. Food diaries in general, just keeping logs of related, is a really simple thing to tease out if your body does not agree with perhaps something in your diet.
Great. Question from Sherry Lynn. She asked, what are causes of high potassium and how to get it down?
Do you want to start with
That's
that?
a hard one.
Yeah.
I mean, in adult medicine, I mean, there are many things, and medications can be a big one that's quite common. But dietary occasionally I find, but
Yes.
I think if you're healthy and your kidneys work, generally, it's okay. I think there are a lot of medical conditions that can cause a high potassium.
Yes. So potassium, we need it. It's it's kind of an essential electrolyte. Our body, like Dr. Hurteau said, our kidneys process it usually, if they're functioning well, really, really well. I've seen, sometimes people get started on, like Brett said, a new medication that may raise or lower their potassium. I have seen people who have, speaking of diets, done something fairly dramatic. They all of a sudden love, they're eating a lot of, citrus fruits or bananas, and they've done something to do it.
That's good.
Sometimes a muscle injury can do it, right? If you
That's true.
right? If
Yep.
because potassium is involved in all our cells, if there's a cell breakdown or a muscle injury, it can cause an elevation of potassium. So,
Yep, I agree.
So I had to look this one up.
that's not good.
No, it's a medication. So Scott is looking for an alternative to omeprazole.
Omeprazole.
Yeah, which is from my research is a protein pump inhibitor
Proton pump, yeah.
for heartburn.
Peter, coming
There
along.
we go. Thank you, Google. So he's looking for, is there any alternatives to that?
Yeah, I'll let you. This is it.
Well, you can use a different class of medication.
Yep.
I mean, you can use Zantac, which is a little bit different medication. It's not a proton pump inhibitor. It's basically an H2 blocker. It's what they call it. So it kind of blocks acid really at the stomach level, whereas the proton pump is more at the cellular level that produces the acid. That's as far as sort of as needed, that might work a little bit better.
Yep.
So if you have intermittent reflux, if you're going to a holiday party and you may not behave, you might want to use Zantac prior to going. But if you are having daily reflux symptoms, a medication like omeprazole can be really helpful and for a period of time. And if you are taking it and still having difficulty, I would recommend following up with your doctor.
Yeah, I think the three kind of major medications for heartburn or upset stomach or reflux, Tums, very common, over the counter, like Dr. Hurteau said, that those work great when they happen. So if you have intermittent symptoms and you want something to relieve it or prevent it, Tums, Zantac, Pepcid work really great. And then if it's a daily symptom or it's persisting, the pharmaceutical companies have done a great job of marketing the omeprazoles, the Prilosec, the Nexiums, and they are very effective. But I totally agree with Dr. Hurteau. If you are requiring those medications, I think you should definitely probably, after 2 weeks or so, see your doctor and make sure there's nothing else driving it.
Yep.
So Brittany, who asked the question about eczema, has added a little bit. She said that she was prescribed a cream called clobetasol.
Clobetasol.
She uses that morning and at night. But she's had eczema and asthma since she was a baby. And this time of year, it flares up, dry, itchy, red patches of skin.
Mm-hmm.
So the flare-up could have something to do with what you referenced as far as the showering or just a change of kind of habits this time of year. Any connection with asthma and eczema?
Yeah, huge connection. I'm not sure if you want it because it's a bit of a pediatric, yeah.
Yeah, and we were talking earlier about sort of allergies to foods, and that we find that a lot in pediatrics. When we have a lot of infants that are struggling with eczema, it turns out they're actually allergic to some of the things that they're eating. And they're for severe eczema, so that doesn't respond. Well, first of all, winter really can exacerbate, so it's much drier time of year. People's heat usually goes on, so if you don't have a humidifier, you should. Have a whole house humidifier, at least one for your bedroom, so that could be helpful. Moisturizers we discussed, but usually if you're on steroid cream pretty regularly, I find, and it's not really working, definitely a dermatologist. There are other medications that people would take either orally or by another means to control the eczema. Yep.
And Peter, to your question, often asthma and eczema are linked almost from childhood. They're kind of frequently seen together, and it's just the body's abnormal response, for some reason in the lungs and actually on the skin. So
Interesting.
Yeah.
Danielle is asking about thoughts on sleeve gastrectomy for weight loss, and I'm not sure how much you guys would like to speak on that, but it's actually something that I could recommend. Is we have a phenomenal weight loss program here led by Dr. Ray Kruger, and I know that the sleeve gastrectomy is kind of the go-to now that he he chooses. When you have someone who comes to you that is interested in any kind of weight loss surgery, what is usually the procedure that you go through with them?
So first, it's super common that we see. I mean, 2/3 of us in this country are overweight or worse. So not a day goes by that probably Dr. Hurteau and I don't see people who are struggling with their weight. And I think the most important thing I like to say, and probably Dr. Hurteau would agree, is number one is that weight loss surgery is a very good, safe option for people who can't lose weight. You know, it's been around for years and years, and there's really good evidence that it helps save lives. It helps prevent or turn around diabetes, high blood pressure, some joint pains, and so there is qualifications to the surgery. It's not everyone doesn't just kind of one size fits all. Usually it's based on how much you weigh and also whether or not you have any medical conditions associated because of your weight, whether you have diabetes, high blood pressure, sleep apnea. And we are so fortunate to have a world-class bariatric surgery program in Wareham, Charlton as well, I believe, that we direct people to. And do you have many patients who have gone through the program?
Yeah, yes, we do recommend it quite a bit. I would second what Dr. Podkowa is saying. We have an exceptional program. I've recommended a lot, especially for patients that have diabetes, other comorbidities, hypertension, hyperlipidemia, joint disease. People who have a lot of arthritis in their knees and their back may have some disc problems. So we often think about weight, but you have to also think about their other medical problems, and that alone, that with their BMIs might actually qualify them based on their medical condition. So it's actually a medical treatment not only for weight loss, but for other medical conditions such as diabetes and arthritis.
And the gastric sleeve, to her question and to your point, I believe is the preferred modality, kind of surgery for the most effective and least complicated weight loss patients.
I know the Roux-en-Y is one that they will still use occasionally as well, but I feel like the sleeve is kind of the first option and the one that most people are going to. But again, I mean, we're so fortunate down in this region at a community hospital to have that. It's the highest volume weight loss surgery program in all of New England, and it's right here, on the Southcoast. So it's a great place to start if you have any questions. And definitely Dr. Kruger has talked at length about what makes this program special is the fact that you just don't come into it and say I want surgery, and they say sure, your surgery date is X, we'll see you then. There's an entire process, a screening process that goes on, kind of a physical preparation for the surgery, a mental preparation for the surgery. There's support. There's nutritionists that support the program. There are psychiatrists that support the program, making sure that all of the any of the issues that might have caused the obesity in the first place, whether it's bad eating habits or eating because there was an underlying issue, those are all resolved so that once you undergo the surgery, you hit the ground running and your results can be great, and you have that support there all along the way if you hit any snags. So it's a phenomenal program, and definitely I can't recommend it any higher from the people that I've met that have gone through it and the amazing results that they've had. Along the idea of diets, and again, I think this is probably one that a dietitian could dive into a little bit more detail, but your thoughts generally on a plant-based diet and the benefits of it.
Sure. That's like whoever wrote that in.
You start with that.
I'm gonna say thank you very much. I cannot speak highly enough of a plant-based diet, and I start with I try to tell my patients more or talk about there's these sections in the world called blue zones. There's a couple of different books on it, and if you and what they are is researchers from National Geographic look to find where the people in the world who live the longest and the healthiest, and who kind of greatly exceed normal life expectations. And they found them, and there's 5 of them. There's actually, I think it's Sardinia, it's Okinawa, Japan, it's Icarius, Greece, it's the Nicayo Peninsula in Costa Rica, and Loma Linda, California. And then they drill down on what are unique amongst these communities, and high on that list is that they eat a 90% plant-based diet. It's not entirely, doesn't have to necessarily be entirely plant-based, and I think that's an important thing to talk about when we talk about diets and patients, because a lot of people get hung up on like all or nothing, and I try to, and it doesn't have to be that way. We're allowed to splurge. We can have, some variation in our diets. I'm actually, I'm pretty much a 95% plant-based diet myself. I switched about three and a half years ago at the time, and changed my life. And so I think it's great, so I recommend it. And it's not easy, but I think there's lots of good recipes and ways to do it. And I found it significantly lowers weight, lowers cholesterol, decreases inflammation. I found people with skin, watching their skin get better as well. Regarding those blue zones and other, kind of habits or traits that those people have in those communities, it's they are active. They move on a regular basis. Most of them live in communities where their jobs require them to be physically active. They do a lot of walking. Loma Linda, California, they do a lot of exercise in that community. They have hobbies. They have things they enjoy and like to do. They live in communities where they have friends and family that they kind of like to be around. They often have like a faith or a purpose they believe in, and they often tend to be thinner or on the leaner side. A lot of them in their different dialects and regions follow with this like 80% rules. Like they stop eating when they're nearly full, not all the way full, which I think is one of the big things we struggle with in this country is portion control, certainly.
I do.
Right?
Yeah.
But I think you can't go wrong with a plant-based diet.
Someone struggled to say this, sarcoidosis.
Oh boy, yes.
So again, thank you, Google. Very rare, only 200,000 cases of this. But Anna's looking for, do you have any recommendation for a good doctor in the area to treat that issue?
Do you want to talk to?
I'm Mr. Europe, but we have Dr. Suzel Luke, who is a Southcoast physician located on Fonts Corner Road, who's a rheumatologist, who deals with a lot of autoimmune diseases. She's excellent. I have a lot of great feedback from my patients, and manages a lot of autoimmune and complex conditions. So, I don't know what you have to say.
Sarcoidosis. I have probably a dozen or so patients who have it. It's a non-infectious, inflammatory disorder that people can acquire. It can affect every organ in the body, and the majority of doctors that care for it too are also pulmonologists. Because a lot of times sarcoidosis can affect the lungs, although it can affect any tissue. But so, in addition to our rheumatologists, our pulmonary department is excellent at handling this and addressing it. And then sometimes we refer people to Boston because there's some great actually sarcoidosis specific clinics at the Brigham and Women's or some of the tertiary care hospitals up in Boston.
They could check out Dr. Curtis Mello, who's a pulmonologist on Fonts.
So in our area, in the New Bedford kind of surrounding area, Dr. Curtis Mello is fantastic. Dr. Christo Capagianos is fantastic. Dr. Janelle Raphael in Fairhaven, where I am, is excellent. And then in the Fall River Market, Dr. Terrence McGovern and his group is excellent to work with. Dr. Emmett Eby in Wareham, also excellent pulmonary. We're fortunate to have a pretty deep bench in terms of pulmonary medicine.
So Doreen, I would ask if you could send us a little more information. She's asking, is it the flu or a sinus infection? I think that we would need a little bit more information, but this has been a subject that I've been around a lot, talking with Dr. Robert Caldas, our chief medical officer recently, as we've been trying to talk a little bit about the flu because it's really expanded regionally. And what he often says is when you have the flu, you kind of know it's the flu. That we use the word stomach flu or flu for a lot of different things, but the actual flu is a very serious thing that will knock you off your feet, and that's kind of how you know that's what you have. Is that accurate?
Yeah, I mean, there are certain criteria that kind of define an influenza, illness. So influenza, it's a virus, it's a seasonal virus, it's a winter virus, so it's here in the cold weather. So you can't get the flu in the summer, So sometimes you hear the diagnostic criteria are often it's a fever, greater than typically 101, a sore throat, and/or kind of a cough, or usually the hallmark symptoms. And then in adults, and this is
Dr.
Hurteau about
I
pediatrics.
agree. Yeah, and it's very similar. So the big three that the cough, right? So you get this cough that's really pretty intense. fever for sure, and severe joint pains, especially back pain. Really interesting if you ask about back pain. That's actually pretty severe. And it's interesting because I think early on it may start like a cold, but I find like within 12 hours it's all of a sudden it's hit and it's pretty severe.
Yes.
And as a physician, we know, like, people say, well, geez, I think I just got over the flu. And it's not likely. When you have the flu, you feel like you need a forklift to take you off the couch, or you've been hit by a bus.
It really is.
Yeah.
It is dramatic. I've had the flu and the same things, and it's funny when people. I always anecdotally think when people say like, "Oh, I think I have the flu," I say to them, "I don't think you have the flu," because people who have the flu don't think they have the flu. They think something's really, really wrong with them. They,
Yeah.
You know what I mean? Like they're like, "Oh my God, I can barely even come into the office. I'm so sick. My body hurts so much. I'm having shaking chills. My teeth are chattering." And often that's influenza. I mean, it's a dramatic. You're very sick. It's hard to come to work, and so it's typically not solid. Versus sinus infections, very common around this time. Often a lot of facial pressure, pain, can have a sore throat. Sometimes people's teeth hurt with sinus infection, so it's a pretty common complaint. Someone that comes in with dental pain, and then actually you wind up diagnosing with a sinus infection. But usually spares the chest and don't get the body, except
You don't
Dr.
get the
Hurteau
body.
recommended it. Yeah.
Maybe we could just elaborate a little bit on the flu vaccine for a minute.
Sure.
So do patients ever come into your practice and say, well, I can't get the flu shot because every time I get the flu shot, I get the flu?
Yes.
And what do you say?
So that's a great question. And it's fever pitch this time of year, and I do tell them that there's a chance when the vaccine is either an inactivated virus, but in order to generate defense against influenza, our body has to develop immunity. So you need to generate an immune response when you take a vaccine, and by doing that, you can feel not so great because something is happening inside of your body. So I tell all my patients, you most likely will feel a little bit after the flu vaccine. Sometimes, in my reading, the first time you've ever gotten a flu vaccine, you probably often feel the worst because it's your newest exposure to it. But you do not get the flu from influenza. And I always tell my patients, I said, God help you if you felt so lousy after the flu shot that you didn't want to get it again. That if you get the real flu, you'll be
change your
miserable.
mind.
You're going to be miserable because it's a
Yeah.
lot worse.
Yeah.
And I think it's important to remember we are in peak
Yes,
flu
we
season.
are.
We are moving into it. It is here now. Flu vaccines take 2 weeks roughly to work. So both of us would probably encourage everyone to get vaccinated. And from a vaccination standpoint, it's looking after not only yourself but also your risk if you're giving it to someone. The people who are at greatest risk for flu complications, young children,
Yes,
and the elderly, and also people who are frail, who may have pulmonary disease, may have emphysema, may have, like someone spoke before, maybe pulmonary sarcoid, or on dialysis, or so if you are around people like that, and you got to be careful that you don't give them the influenza because they could have a rougher time
Sure.
than you will.
And I've seen the flu in infants and children, and it's severe, and it can require hospitalization.
Yeah.
And so I spend a lot of time encouraging my parents to please get a flu vaccine, right? And make sure your children 6 months or above get a flu vaccine.
So this question came in anonymously, and it is a question about penile implants and about is that something that can be done in this region? If so, and I guess maybe the more broad question is if a guy comes in with ED and is looking for a solution, maybe I guess the first part of this question is, at what point, I mean, what do you kind of start with as far as what's the first recommendation, and then in your knowledge, when do you get to the point that you're starting to consider an implant per se, and then who are you sending them to in that situation?
Yeah.
Well, that's a tough question. I mean, with erectile dysfunction or problems with erections, it really depends on the reason for it. And there are many, so there are hormonal causes for that. There's medication-related erectile dysfunction. There's mood-related. There's substance abuse-related. People may have conditions that affect their nerves, like diabetes. People may have had prostate cancer, had their prostate removed, and are unable to have erections. So I think it really matters, again, seeing your primary and working through what the causes really are. I don't have a lot of experience with implants. I have some that have, and most of it's related to, they've had a previous surgery, a urological surgery for which they've needed it. I don't know what your experience is.
I echo Dr. Hurteau. From a primary care perspective, many things can cause trouble with erections, and we can help you work through that, whether all the things. If it gets to a point where we are not having success, we refer to urologists. That's the type of doctor who specializes in the penis, erections, the prostate, and in this area, if they were going to do an implant, it would be a urologist. And we're fortunate in Fairhaven and Fall River to have an excellent urology group that we work pretty closely with. So the good news is on the erection front is that there's a number of therapies medically and then surgically, and then also injection-wise before you get to a surgical perspective that can help with erections.
Is it common that most urologists would do this implant, or is it kind of a specialty that you'd have to?
I can't answer that actually.
Yeah, I don't know. I would say, just thinking about my patients, I would say it's not that common. I don't know about your experience. So again, I guess I can't quite answer it.
Yeah.
I would say.
So what would just be the next step? Would you say to maybe call like so? Dr. LaRocque is just a urologist that I have off the top of my head. Maybe give Dr. Dennis.
Yeah. So in the Fairhaven market, there's Dr. Dennis LaRocque, there's Dr. George Torini, Dr. Michelle Pacheco, and in Fall River, Dr. John Carroll, Dr. LaRocque is there as well, Dr. David Begg, I believe.
So if you're looking for more information and you're trying not to, maybe you're not comfortable going to your primary care on this, and you're trying to keep it tight, maybe give a call to one of the urologists. Go to southcoast.org. Right there on the homepage, there's a tab where you can click on doctors. You can search by specialty, so you can search by urologists, and they'll all come up, and maybe just try one of them. If for whatever reason you're from the area and you're not really looking to have the surgery done locally for whatever reason, you're embarrassed or whatever it might be, I'm sure. You maybe look to Boston or Providence. But good luck to that person who sent that question in. Question from Pat, and it's: does Mass Health cover gastric bypass or sleeve procedure? I'm not sure if one of you want to take that. I know from experience that it generally insurance does cover.
It does.
Weight loss surgery.
I think there's a fee, but that's for every insurance, right? There's a fee, and I think it pretty much covers the psychological evaluation piece. If I'm correct, I don't know.
I'm 99%. That it does.
Yeah. Again, Dr. Ray Kruger, Southcoast Center for Weight Loss. You give them a call. Michelle Croft is the administrative assistant over there. She handles all of the logistic stuff. Give a call. I'm sure she could answer any of your questions about insurance coverage. Pat asks a follow-up question about removing extra skin after weight loss surgery. Is that covered by Mass Health? Again, great question.
That's a more complicated question, unfortunately, and I don't have a yes/no answer to that. Yes.
So I know that might be a procedure that's actually done by by plastic surgeon.
Yes. Yep.
But I would assume, by how comprehensive that our weight loss center is, that if you call there, they will know, or they will be able to point you in the direction of someone who knows. So give them a try. Good luck with that, Pat. So from Danielle, she has a pseudotumor cerebri. And I'm not exactly sure what the question is, but it's something along the lines. She says it was recommended to fix that, and I'm not sure if she's asking, do you agree that it's something that you should?
So was she that the weight loss surgery was recommended to fix the pseudotumor?
No. This is a different question.
Okay.
This is from Danielle. I'm sorry. It's Danielle. If you can write back with just a little bit more information and maybe a little bit more of a specific question of what you'd like the doctors to answer, that'd be great, and we definitely will try their best to answer your question. So Chris is asking. He's saying he's using the VGO device to deliver his insulin, and it's helped his type 1 diabetes management. Only problem is the adhesive is causing skin irritation. What's the best over-the-counter ointment or powder to alleviate this?
I don't have a good recommendation on Dr. Hurteau.
I don't. Knowing that with that device, I'm sure he has an endocrinologist. I would probably reach out and ask what they would normally do. I mean, it sounds like a contact dermatitis from the adhesive. I mean, typically with a contact dermatitis, it's using a mild to moderate steroid cream to kind of help alleviate that. But given the fact of it's tough to manage, and I think I would probably just defer back to the specialist on that one.
The only point I think also I would add to Dr. Hurteau is sometimes if you talk to the manufacturer, or I'm not sure there's someone who makes the device, often with them, they may have a recommendation, because I bet you other people may have had a similar reaction, and they often are good at kind of recommending, different strategies.
Maybe an
for them.
alternative.
Yes, or if you're working with a diabetic educator, or if there's someone else. But oftentimes the manufacturers themselves are very good at helping patients with this.
So let me make a quick pitch to all of the Southcoast patients out there. If you haven't signed up for my chart, I highly recommend you doing so, because through my chart you actually have the ability to email your doctor directly, and so a lot of these questions that you might be afraid to call and ask, or you're not quite worried enough about it to make an appointment to ask your doctor, you can always email them through my chart. And I know my primary care doctor is very good about getting back to me within that same day, and so you can ask these questions. And I'm not sure, I don't see specialists, so I'm not sure if you'd be able to communicate to them as well.
They're excellent.
On my chart. So there's a chance that you can shoot a quick email right now to to whoever is seeing you for your diabetes, and they might be able to answer that question for you within the next 24 hours. So I do highly recommend for patients to sign up for my chart, because beyond that, there's lab results that you can get, and a lot of your health information is right at your fingertips. So it's a really good tool. So Tiffany is asking, she just says blisters. So I'm gonna make up my own question and just say, if you're suffering from blisters, what generally is a good way to treat them? And we'll say that they're blisters that you have on your hands or feet, although hers might be more
Sure. Any thoughts?
Assuming they're sort of blisters on the feet, let's say, they're usually trauma related, right?
Mm-hmm.
So a lot of times it's usually from excessive irritation, rubbing, or pressure. So I think first and foremost, you have to alleviate that. So you have to try to figure out, what it is. So if it's footwear, you have to take a look at that. A lot of times people will wear certain shoes for work because it's required, and a lot of times that will cause problems. So it may be shifting that and looking at that. Normally, if it's just a blister that's trauma related, you really don't do too much. It will resolve on its own. It's really just about alleviating the actual cause of it. Sometimes people say blisters and they might mean cold sores, so I don't know if that's what the person really means, but if that's so, they can always write back.
Yeah, so let's say it was cold sores. What are some remedies that you would recommend?
So that's totally different. So a cold sore is actually a viral manifestation, or caused by a virus. It can manifest itself on the mouth, the herpes simplex virus. There are topical and oral therapies, because they can be painful, they can be unsightly, and for people. So depending on the patient, how often they're coming, right, Brett? Usually we either use a topical therapy, or sometimes there's pill therapy. That is usually 2 tablets in the morning, 2 tablets at night for one day, that have a medication called valaciclovir that work really well for knocking them down and getting the cold sores to go away.
Last question that we currently have. Please, feel free to send any more along, either through the comment section or through the anonymous phone number that Josh has been playing throughout the night up on the screen. Again, that's 508-717-8948, 508-717-8948. Question from Alexandra. What's the most popular birth control? She's heard that Necplanon, I believe.
The Nexplanon, yeah.
Makes people moody. Can food balance the hormones in the medication? Oh, so these are okay. It's not every. These are. Let's take the first one. Let's take the first question first. What do you recommend for birth control for folks? Does it vary depending on what?
I mean, it really varies upon, when we do consultations, it depends on the patient. So it depends what they're looking for. There's hormonal and non-hormonal ways for contraception. Typically, hormonals are either oral contraceptives. There are some actual intramuscular injections you can get, and then there's actually implantable devices like the Nexplanon, which is under the skin, or an actual intrauterine device that's placed in the uterus. A lot of times when we think about birth control, we think about what is the objective here. Is it just for contraceptive purposes, or do patients actually have other medical conditions for which it would be helpful? So, for example, if a woman were to have really abnormal or heavy periods, an intrauterine device would be great because it will manage that. Oftentimes it will minimize or eliminate periods. Generally very well tolerated, and less side effects related to headaches and mood changes. Whereas when you're dealing with hormones, whether they're implantable or oral, I find that a lot of my patients tend to have more of those side effects: headache, mood changes, bloating, sometimes weight gain, acne. So those are some of the things that I find. So as far as, so when we do consultations, it's really about, what's the goal and objective of the patient? For some people, they'll say, well, geez, I really can't take a pill. I will never remember that. So I need something that I don't need to remember. Or I have a history of migraine headaches in which hormonal therapy may not be a good idea. So you may need to look at other things. So I think the first thing is, seeing your doctor and having a consultation about different options for birth control and what might work.
The only thing I want to add to that, just from a family planning perspective, that it's not only women who should be responsible for birth control, right? And that in certain relationships and times that men, that there's vasectomies and procedures that are also safe and effective. That I think in relationships that people discuss, in terms of the best choice of birth control for the couple. And we've been on a urology topic a lot tonight, but our urologist, we definitely know for sure that is not something you have to go anywhere special for. That is your urologist's bread and butter in doing vasectomy. They do it right in the office.
So since we're on the subject of vasectomies, I'm a father of two. Do not plan on being a father of three. Have not gone that route, but I've heard rumors from friends that there are criteria for vasectomy, or at least being covered, that you need to have X amount of kids, or be certain. Is that true at all, or is it? Do you have
I
any
actually
idea?
don't
There
know
probably is there is a criteria, I believe. I don't know it, but much like even when women are seeking permanent contraceptive, like tubal ligation, there is criteria. Like, for example, young women who haven't had children, and there's a process by which they don't just do that. So I can't, but we generally refer to the urologist for consultation.
Yes.
Go ahead.
Yeah, I had a vasectomy. I remember meeting with my urologist, and you meet with them first to go over to make sure that you understand that it's permanent, that they can be reversed, but it's not always, and so there are criteria before, because it is a surgery. All surgery has inherent risk. It is very permanent. Like I said, reversible sometimes, but certainly it's not to be something to be taken lightly. But it is a safe, good option for men.
So the second part of Alexander's question was just about balancing the hormones. I'm guessing she says medication, but I'm guessing she's talking about birth control still. Is there any link between diet and hormone control that you guys are aware of?
Well, I mean, I think high-fat diets are generally not good. I mean, I think not only does it lead to obesity, but it will create some issues with women and hormones, especially androgens and male-type hormones. So, but I can't say that I have I don't think I can answer that appropriately, to be honest with you.
And then the final part of her question is, when should someone see a nutritionist? And I'm guessing that's linked to the birth control question originally, in the food balance and the hormones. So, I mean, when pull back from that question and just ask generally, When do you generally refer patients to see a nutritionist? What are kind of some of the situations when that would apply?
I find commonly it's diabetes and obesity, but hypertension, hyperlipidemia are other common things that we see that would be appropriate to go ahead and refer.
Sadly, that is something that is dictated a lot by insurance. I wish that most people could see a nutritionist who wanted to see a nutritionist. As like we said before, like being overweight or obese affects 2/3 of us, and being overweight or obese causes so many medical problems that I'm amazed that we don't spend more time in schools and we don't have more access to learning what is good foods, what is bad, and how we should eat, because it affects so much.
Sure.
And it's at a fundamental level kind of the first step in your health. Bad food, bad moods, and so we'd like to, I think, refer to nutritionists as often as possible, but oftentimes they're still catching up. That, like Dr. Hurteau said, it's patients who are diabetics will pay for also if there's obesity, if there's a kind of a complicating factor because of the weight. But I think if you are struggling with weight loss or just have questions about food, if your insurance will allow it and you have the interest, I think it's a fantastic option to learn, kind of more about, our food.
Maria asks, my husband has been experiencing daily night sweats. What can cause this? He's in his 70s and has sleep apnea.
Well, night sweats, that's for physicians. I mean, that's, it's kind of, unfortunately, it's kind of like headache, someone, so geez, I have a headache, what could it be? Well, it could be many, many things. And so medications are, things to think about, underlying medical conditions, even such diabetics, can have issues. And so I don't know. I don't know that I can answer that, because I think it's such a big, if we would take a look at that symptom and we would just do a quick list of things that could, it would be pretty vast. And I think we wouldn't be doing it justice to just say here it could be this, it could be that. And
that is in terms of like what we do as primary care doctors, or I think it's important. This question can help illustrate that way. When you come to your doctor and or your nurse practitioner or your physician's assistant, and you come with a complaint, and this is a great example of like why you see a primary care doctor, where when you have something going on that you don't know what it is. Someone says night sweats, and in our mind, like we're through school, what we do is there's a list of things like Dr. Hurteau just said. So it could be as simple as the heat being off in the house. It could be that you have diabetes. It could be that your thyroid is abnormal. It could be a new medication that you started. It could be lymphoma. It could be another type of cancer. It could be something in your diet. It could be something seasonal. So. And then what we do in a way is in our mind we line up, all those different things that could be causing it based on who that patient is, what type of medical problems they have, what type of medications they are, how old they are, and you start asking other questions. Have you lost weight? Do you have any lumps or bumps in your body? Have you started a new medication? And you help narrow it down. But for sure, I think we would both agree that we can't answer that question here, but that night sweats can be a serious symptom that should be kind of further fleshed out, so you find out what may be causing it, or certainly make sure some bad things aren't causing it at least.
Sure.
Right?
Yep.
So we tell him, Maria, get your husband to his primary care doctor.
I would.
That's right.
Yeah.
Mm-hmm.
So that's all the questions that we currently have. Please send along. We have probably about 5 more minutes left if there are any questions. Please, you can send them in the comment section below, or you can text them, and that number is 508-717-8948, 508-717-8948. Again, we have a few minutes remaining. Just while we're waiting, anything that you guys wanted to hit on? I know Christmas.
Yeah, so I would just like to reiterate, as Dr. Podkowa does, I'm sure, weekly, is the importance of primary care. And I think what's lost in a lot of what's going on in modern medicine is the relationship between a doctor and a patient. And many of the symptoms we spoke about tonight, it's a matter of putting it in context. So, and I said this to a patient earlier this week, anyone can type in a symptom on Google and get a list. But what matters is context and experience, and knowing your patient and knowing what the possibilities are. And that's the value of having a physician. And So in many ways, it seems like an old school concept, but it is so important, and I can't stress that enough. So I just want to say that it is really important, and if you don't have a primary care physician, you should have one. We have excellent doctors here at Southcoast, so I'm sure we'll be glad to help and accommodate. But I just want to, I guess I'm just wanted to make a plea for primary care and for medicine in general. I think that we know through studies that patients will get the most appropriate, high quality, cost effective care when they see their doctor versus seeing multiple doctors.
Yeah. The countries and the communities around the world that we aspire to be like in this country that that are living well, healthy, and spending kind of the least amount of money on it, have more primary care doctors than in other parts of the world. So it is, I think, working together with us, we can really help try to address and diagnose problems early, which is often the best time to solve them and help you coordinate things when necessary.
So a question here from Doreen, and I'm sorry, Doreen. She said she's asked this question 3 times, but it's the first time that I've seen it come out. We certainly haven't been ignoring your question, but she's asking about Ehlers-Danlos syndrome.
Mm-hmm.
Are you familiar with it? Just what resources are there in the area? I think she's looking for. What would you recommend?
So do you from a pediatric standpoint, do you see much of it? I have a couple patients with it.
I have a couple of adolescents, yeah, for sure. But
so it's what's called a connective tissue disorder. It is, in my practice, not common, and the patients who I have with it actually go to, I believe, either it's Brigham and Women's or Massachusetts General, where there's a clinic for it. Absolutely.
Yes, and they're monitored for specific, symptoms and conditions
Yes.
related to the disease.
Yes.
I'm gonna butcher this. I know this one, but I'm gonna. It's Gillian Barre syndrome. Barre syndrome.
Guillain-Barré.
Guillain-Barré. There we go. I know. I've seen that before.
Yeah.
So, 50-year-old has had it about 10 years ago. Was told no longer could take the flu shot. I know that's where I've seen it before,
Mm-hmm.
related to the flu shot. Wondering, he or she, this is anonymous, is wondering if that rule applies to the tetanus shot as well. If there's any connection there.
Not that I'm aware of.
It's not that I'm aware of. Either.
I would double check that
Yeah.
because I kind of run that when I'm with patients who present with that. But I believe there is not a contraindication to tetanus
No.
shot.
Best resource for that patient to kind of find out, give a call to
The primary care doctor
Yeah.
or the pharmacist,
Yeah.
or pharmacy.
Yep, pharmacists are very helpful.
Last question is from Doreen. She is asking, how long should acid reflux medication be taken at one time, or within one stretch?
That's a great question. I think it really depends in many ways. For someone who has reflux, say initially, and decides, well, I'm going to do a course of Prilosec. I mean, that's why you'll see on the insert, it'll say, okay, don't take it longer than so many weeks, and So I think initially that's true. I mean, I think that I find, okay, take a brief run of it for 3 to 4 weeks, and if you're still having symptoms or it doesn't resolve, then I think that's a time to see your primary. Now, as far as, I have patients on these medications, proton pump inhibitors, but for a variety of different things. People may have had ulcers, persistent and bad reflux, for which, despite, having upper endoscopies and making sure nothing really bad, they haven't responded to dietary changes and other things. So although we don't look to keep people on these medications long-term, some people do need them.
Yeah, I think Dr. Hurteau's point, if it's persisting for more than, say, 2 weeks or a month, to find out what's driving it, and then then how you treat it will, I guess, be dictated by that. And I think the current guidelines are to use the least potent medication as possible for as short a period as possible to try it. I mean, some people need, and this comes down to, we've talked about in the show before, risk and benefits. And so uncontrolled acid reflux is really dangerous. It can cause a host of problems. So therefore, the risk of taking a Nexium or a Prilosec or anything like that long term is small. But if your heartburn isn't that bad and you don't need to be taking a potent medication like that, you could probably try to, go down to something not as strong, like Dr. Hurteau mentioned earlier, a peptid Zantac. Yep.
So I think we're going to wrap it up here. I'll let you take it home in 1 second, Dr. Podkowa. I just want to say that we are going to take next week off for the holidays, but we will be back here the first Wednesday in January, and we got a bunch of great shows lined up moving forward. We'll do a whole bunch more of this. Dr. Hurteau, thank you so much for joining us.
You're very welcome. Thank you. Thanks for having me.
Yeah, Dr. Hurteau, thank you very much. And if you were looking for a family doctor, Dr. Hurteau's office actually is accepting, pediatric and family patients. So that number could be on the website. I'd like to thank everyone for, watching tonight. And if you've watched before in the past, we really appreciate it. For everyone who has shared the video or told someone about it, we want to say thank you, because the numbers of people watching the show have improved, and we think that's a great thing. We think, access to discussions about primary care and your health and kind of a collaborative education environment is really good for our community. And healthy communities are contagious, we know that. So on behalf of Peter and myself, thank you very much. And Merry Christmas, Happy Holidays, and we'll see you on the other side of 2018, right?
Yeah. Happy New Year.